What is rectal prolapse? Rectal prolapse is a condition where the rectum, the final part of the large intestine, slips out through the anus. This occurs due to weakened pelvic muscles, leading to discomfort, bowel issues, and, in severe cases, visible protrusion of the rectum outside the body. Rectal prolapse can be partial, mucosal prolapse, or complete full-thickness prolapse, and often worsens over time if left untreated. It is more common in older adults, women, and individuals with chronic constipation or pelvic floor dysfunction. Types of rectal prolapse. 1. Partial prolapse, only the inner rectal lining protrudes through the anus. 2. Complete full-thickness prolapse, the entire rectal wall slips outside the anus. 3. Internal, hidden prolapse, the rectum folds inside itself but does not exit the anus, rectal intussusception. Causes of rectal prolapse. Several factors weaken the pelvic muscles, leading to prolapse. 1. Chronic straining and constipation. Increased pressure weakens the rectal tissues. 2. Aging and weak pelvic floor muscles, common in older adults, especially postmenopausal women. 3. Pregnancy and childbirth. Vaginal deliveries can stretch and weaken pelvic muscles. 4. Neurological disorders. Conditions like spinal cord injuries, multiple sclerosis, and stroke affect muscle control. 5. Chronic diarrhea. Frequent bowel movements can strain rectal tissues. 6. Pelvic surgery or injury. Prior surgeries may damage supporting structures. 7. Heredity. Some people are born with weak connective tissues, increasing prolapse risk. Symptoms of rectal prolapse. A bulging mass from the anus may retract or remain outside, feeling of incomplete bowel emptying after defecation, mucus or blood discharge from the anus, anal discomfort, pressure, or pain, loss of bowel control, fecal incontinence, itching or irritation around the anus, difficulty pushing the rectum back inside. Diagnosis of rectal prolapse. Doctors diagnose rectal prolapse through 1. Physical examination. The doctor may ask the patient to strain during examination. 2. Defecography, X-ray or MRI scan, shows how the rectum moves during bowel movements. 3. Colonoscopy, checks for underlying conditions like tumors or inflammatory bowel disease IBD. 4. AnoRectal manometry, measures muscle strength and function of the rectum. Treatment of rectal prolapse. 1. Conservative non-surgical treatments, diet and fiber supplements, high-fiber foods, and plenty of fluids to prevent constipation. Stool softeners or laxatives reduce straining during bowel movements. Pelvic floor exercises, Kegels, strengthen anal and pelvic muscles. Manual reduction. In early stages, the prolapse can sometimes be gently pushed back inside. 2. Surgical treatment. For moderate to severe cases, rectopexy, rectal fixation surgery, the rectum is stitched to the pelvic wall to hold it in place. Resection surgery. A portion of the rectum is removed in severe cases. Perineal surgery for older patients. Less invasive procedures, such as the Altemeyer or Delorme procedure, are used when abdominal surgery is too risky. Complications of rectal prolapse. Chronic pain and discomfort, ulceration and bleeding of the prolapse tissue, fecal incontinence, loss of bowel control, strangulation of the rectum, cutting off blood supply, medical emergency. Prevention of rectal prolapse. Eat a high-fiber diet to prevent constipation. Stay hydrated to maintain soft stools. Avoid excessive straining during bowel movements. Exercise regularly to strengthen pelvic floor muscles. Seek early treatment for chronic constipation or diarrhea. Conclusion: rectal prolapse is a progressive condition that worsens if left untreated. Early management with diet, pelvic exercises, and lifestyle changes can help mild cases, while severe prolapse may require surgery. Seeking medical attention as soon as symptoms appear can prevent complications and improve quality of life. Thank you for watching my video. Please subscribe my channel.